Bismillahirrahmanirrahim. Dear students, hope you all are fine. Today we will discuss about vitamin D. In vitamin D, we will talk about forms of vitamin D, sources of vitamin D, metabolism of vitamin D, functions of vitamin D, and pathological conditions related to vitamin D deficiency. First, vitamin D. Vitamin D is a fat-soluble vitamin and group of sterols that have hormone-like function. Vitamin D have two forms, vitamin D2, which is ergocalciferol, and vitamin D3, cholecalciferol. D2 is obtained from plants and D3 is obtained from animals. Sources of vitamin D. Sources of vitamin D include D3, exposure of skin to sun, fatty fishes, liver, and egg yolk. And D2, which is ergocalciferol, is found in fungi and yeast. Dear students, remember that milk is not good source of vitamin D. Vitamin D endogenous synthesis and how it can be metabolized. First, when our skin exposed to sun, the ultraviolet rays come from the sun in dermis. The 7-dehydrocholesterol converted into cholecalciferol by the help of ultraviolet rays, and the cholecalciferol goes to liver. 7-dehydrocholesterol in the serum and cholesterol precursor photochemically converted to vitamin D3 in the skin, right? In liver, cholecalciferol is converted into 25-hydroxycholecalciferol in the presence of 25-hydroxylase enzyme, and in kidney, 25-hydroxycholecalciferol is converted into 125-dihydroxycholecalciferol in the presence of 1-hydroxylase enzyme. In kidney, vitamin D active form is calcitriol, right? Remember students, 25-hydroxylase and 1-hydroxylase, they both are important for MCQs, and the calcitriol goes to the intestine and bones. Function of vitamin D. In intestine, it increases what level? Calcium and phosphate level. In bones, the function of vitamin D is at low level it increases mineralization of bone, while at high level it increases bone resorption. Remember students, overall the function of vitamin D is to maintain serum calcium and phosphate, right? When calcium level low in serum, it activates parathyroid hormone, which has positive effect on 1-hydroxylase enzyme and convert calcidiol to calcitriol, right? Low phosphate has also positive effect on the 1-hydroxylase enzyme. The calcitriol goes to intestine and goes to bones, and it increases absorption of calcium and phosphate to maintain serum calcium and phosphate level. How vitamin D absorbs calcium and phosphate from intestine. First, calcitriol goes to enterocytes or intestinal cell. Calcitriol and intracellular receptor protein bind to form calcitriol receptor complex. The calcitriol bind to specific site of DNA in nucleus and form messenger RNA, and messenger RNA form a protein called carbindin. Right, with the help of carbindin, calcium goes to blood, and it also helps to increase absorption of calcium from intestine. Understand? Action of vitamin D on bones. First, we will understand a short and important terms, which is osteoclast and osteoblast. Osteoblast cells, these are bone forming cells. Osteoclast, these are bone dissolving cells, right? Osteoprotegerine, OPG mean osteoprotegerine. OPG inhibit osteoclast differentiation and function. Rankle full form you see in bracket, and rank full form you see in bracket. Next, when parathyroid hormone and vitamin D act on osteoblast cells, it has positive effect on rankle receptors and negative effect on osteoprotegerine protein. The rankle receptor bind to the rank receptor of the osteoclast precursor, and osteoclast precursor differentiate into osteoclast, and osteoclast do resorption. Understand? And take calcium and phosphate, and this calcium and phosphate goes to the circulation or blood, right? What does OPG do? OPG protein bind to rankle receptor to form a rankle OPG complex. The rankle OPG complex does not allow the rankle receptor to bind with the rank receptor. The osteoclast precursor does not differentiate into osteoclast. OPG inhibit osteoclast differentiation and function by forming rankle OPG complex. Recommended dietary allowance: 1 to 70-year-old, it required 15 mg per day. Above 70-year-old, it required 20 mg per day. Supplementation is recommended for breastfeeding babies because milk is not good source of vitamin D. Pathological conditions related to vitamin D deficiency and toxicity. Decreased vitamin D or deficiency of vitamin D can lead to serious problems, which is rickets in children and osteomalacia in adults. First, we will discuss what is rickets. Rickets is the softening and weakening of bones in children, usually because of an extreme and prolonged vitamin D deficiency. Bone organic and inorganic components. Organic components, which is 30%, collagen type 1 95%, non-collagenous protein, which is 5%. Inorganic components, which is 70%, hydroxyapatite, include calcium and phosphate, which is 95%. Organic component give strength to bone. Inorganic component give rigidity to bone and bone formation and maturation through calcification. Pathophysiology. In pathophysiology, if there is deficiency of vitamin D and no sunlight exposure can lead to not enough active form of vitamin D, which is calcitriol, can affect intestine. It decreases intestinal calcium absorption, which can lead to decreased calcium level in blood, the term called hypocalcemia, and it has positive effect on the parathyroid hormone. In bone and in kidney, what does it do? We will discuss next. In kidney it increases reabsorption of calcium, and also it increases phosphate excretion. In bones, excrete calcium to maintain serum calcium level, right? So it will lead to decreased calcium and phosphate in bones. Calcium and phosphate both are essential for bone mineralization and rigidity. If there will be decreased calcium and phosphate in bones, can lead to rickets, which is poor growth in bones, and bones become soft and weak. In rickets, we see a child with bow legs. Osteomalacia. Osteomalacia, it occurs in young and older adults. Same like rickets due to chronic vitamin D deficiency in young adults present with bowlegs. In older can lead to fracture. Patient present with bone and muscle pain. Patient with osteomalacia can see like this. Treatment include vitamin D supplements, eat food that are rich in calcium and vitamin D, give oral vitamin D to breastfeeding baby. Right. Hypocalcemic tetany. Hypocalcemic tetany occurs as a result of chronically low level of calcium in blood. Chronic deficiency of vitamin D can lead to hypocalcemia, and then it can lead to hypocalcemic tetany due to parathyroid gland impairment. Clinical features: muscle cramps, numbness and tingling in hands and foot, fingers, seizures you can see in a given figures. Treatment: in treatment, give intravenous calcium replacement. Right? Secondary hyperparathyroidism. Chronic kidney failure. It increases blood phosphate due to less excretion and decrease formation of active form of vitamin D, which is calcitriol. Both conditions increase secretion of parathyroid hormone, which can lead to secondary hyperparathyroidism. Vitamin D toxicity. Vitamin D toxicity. What happens when vitamin D is increased in blood? Taking 60,000 a day of vitamin D for several months has been shown to cause toxicity. Excess vitamin D causes, which is loss of appetite, nausea and thirst. Understand? Efficiency or increase vitamin D. It can enhance calcium absorption from intestine and extract calcium from bones. Can lead to hypercalcemia. In hypercalcemia, deposition of calcium in arteries and in kidney, deposition in kidney may lead to kidney stone formation. Thanks for watching. If you like this video, please subscribe my channel and press